I always try and think back to like my personal experiences with my family to be honest and empathetic. So every patient, I think, has a right, and it's our job to tell the patient the truthful findings that we have. But I think there's also a fine line that you have to walk to be hopeful as well. Because even though we may be expressing a lot of very bad or devastating news, depending upon what the news is, I think that it's very important, if there are options that are available, to express those honestly and hopefully, because to take away a patient's hope that at least there are options. Yes, I would never want to be dishonest and not tell a patient, you know, unfortunately, we're not going to be able to cure you and we're never going to be able to make this cancer go away. I say that all the time, oftentimes in just those words, which I think are more kind than other choices that you could make in terms of how to express that, but yet it says the same thing. And it also is important to tell those patients, but we have these 5 things that could be used in, you know, in sequence down the road to try and do everything we can to keep this controlled for as long as we can. So there's a way to say it that I think doesn't make it any easier for the patient to ultimately process and handle, because at the end of the day I'm saying the same thing. You have a cancer that I can't cure, which is very hard to do, because you know what that patient and that family is going to feel, no matter how well I say it. But I think that I try and make every attempt to say it as honestly but as kindly as I can, with hope, because, you know, in most instances we have lots of options to offer. In some instances we have no options to offer, and then we also have to help that patient and family move toward supportive care as opposed to active care.